My name is Marydell Hayes, and I'm excited to be with you here with the Together SC team. And we've got a great webinar prepared for you today, whether you're here with us live or you're watching this later. We know that folks who work for nonprofits need access to very affordable and helpful benefits that will ensure that they can stay in this wonderful sector. We know that our compensation and benefit study that will be coming out later this fall will really show the dramatic impact that having a robust benefits package has on your employee retention and your ability to attract top talent, which is one of the strategic pillars of Together SC's work, is making sure that you've got access to the best talent that you possibly can. And so I'm really excited to start off by letting our COO, Ben Bullock, the wonderful Ben, talk about our association health plan, just to give you a little preview of it and to let you know how you can find out more.
Hey, well, thank you, Marydell. When you said that a second ago, I went, who, me? And y'all see that I'm in my car, but I have parked. I am not currently driving while talking to you, so fear not for my safety. So the association health plan, if y'all haven't heard me say this before, it has really been a effort of love over the last couple of years. We have wanted to have an association health plan for a very long time, and the environment wasn't right until about a year and a half ago. And we explored the idea with our friends at the United Way of Greenville County, Marsh McLennan Agency, and Blue Cross Blue Shield and the United Way Association of South Carolina, brought this idea and said, hey, we think we can make it work now. And so we put all the paperwork together. We created the association health plan, and I'm proud to say we now have 17 organizations in it, covering 100 and almost 120 employees. No, I think we're close to 150 now. So we've got a good group of folks in the plan already. We are offering 18 different medical plan designs. Some of those are traditional lower and mid deductible range health plans. Some of those are higher deductible health plans with health savings accounts that are eligible for health savings accounts. And then two of the plans, which I think are the most interesting, are health incentive account plans, where the deductible is kind of in the middle range, but if you take certain steps through the plan year, such as getting preventative care visits, such as logging activities that contribute to your health, your deductible will be brought down a little bit. And so I'm in one of those myself, and I think it's a really interesting alternative. In addition to the 18 different health plan designs, there are 2 dental plans. One offers orthodontia and the other one doesn't. And there is 1 vision plan being offered. All the details for these plans and what are entailed in the deductibles and what the co-pays and everything are, those are actually posted on our website on a flyer, which we'll make sure to include in the email for this call. The way you would find out more, and this is the thing, is I generally get people calling and asking and saying, well, hey, how much does it cost? Unfortunately, I can't tell you, because, and not because I'm holding it back or anything, it's because I don't know. There are 20 different pricing tiers for each of those plans. So if you wanted me to tell you how much it would cost, I'd have to break out this really giant table, and then we'd have to do all the underwriting to figure out where you might fall in that table. And they pay people who are much smarter than me at Blue Cross Blue Shield to do that. So the way to find out which pricing tier you would be in would be to submit information to the broker, David Slade at Marsh & McLennan, and to get a proposal from Blue Cross Blue Shield. It costs nothing but your time to get a proposal. And what I'll say is, at this stage in the plan, it may not be the cheapest option for everyone yet. So if you get a proposal back and you say, this is not really quite as, we're about the same as our current plan, that's okay. Check back with us in a couple of years, because the more people we get into this plan, the more organizations we get into this plan, the better the pricing gets for everyone. So that's the quick rundown on it. All the information that we have is posted on the website, on the Together SC website. You do need to be a member of Together SC in order to enroll in the plan. You don't have to be a member to get a proposal. But once you say yes to the proposal, you do need to be a current member of Together SC and maintain that membership. We are not able to offer the plan to anyone that is just one person in the shop. We need to have at least 2 employees per organization to make the plan work. There is a sign-up form on that webpage on the Together SC site that when you can put in the basic information about your organization, and that information goes to our broker, who will then reach out to you and get the process started for getting a proposal. And that's my spiel.
Thanks, Ben. I went ahead and dropped the link for the association health plan in the chat, and so that's easy to access and a lot to follow up with. And I'm really excited because Ben was just the appetizer, and now we get to move on to the entree. And although you were a delicious snack, Ben, we appreciate the information. What I'm really excited to share with everybody is the material that's yet to come. And so we've got with us Maria Lund from First Sun. First Sun is an employee assistance program, and I'm really personally passionate about EAPs. I think that EAPs can be one of the, as a former executive director, offering an EAP was an incredible benefit both to me and my family and to my employees. And I could talk on and on about how great it is forever, but that's why we have Maria here. And so with that, I'm going to turn it over to Maria and let her share a little bit with you about why we think EAPs are such an important offering for nonprofits to include in their benefit.
Wonderful. Thank you, Maridel. What I'm thinking to do, I have a PowerPoint. I'm going to bring it up and walk through it. And I'm going to talk just briefly about the kind of stuff that we're seeing in organizations that we help with, and then the kinds of help that we offer. And I'll say right at the outset that we are working with Together SC to pull together a consortium style product for all of you. And I say that with passion in my heart too, because I not only love First Sun EAP and EAP services, but we too are a small group. You know, our group is only 20 people large. So we really love to do things that focus on small groups, and most of our business is in small group. But even when you look at small group, it's still, you still have to pay sort of a base rate. So what we're trying to do is put together something that's going to take that away for you guys so that it's really affordable for groups of 1 to groups of 100 or however big you are. So with that, please jump in. If I say something that you don't understand or you have a question about, we're going to have questions at the end, but you're welcome to jump in too. I'm going to talk pretty quickly, and I'm going to also send this PowerPoint. So if you guys want to see it afterwards, you can take a look at it. Okay, so here we are. First Sun's been here for 30 years. We're celebrating 30 years in October, and we are a South Carolina-based employer. So most of our employees are in South Carolina. We know South Carolina business. We know South Carolina resources. So that makes us a really strong local partner. And what I'm here to say today is that, as every one of you guys knows, I mean, mental health is not some sort of frill thing anymore. I mean, it's really a business imperative for your employees to have their well-being. I mean, through COVID, we all saw how difficult it can be to run a company if your people are not churning at their best. And, employees are wanting services now. They're starting to pick employers based on what kind of benefits you have. And EAP is a benefit that you can get for a very low cost. It's not usually affordable for tiny little companies, but we're working on something that's going to make that. affordable for you. Okay, so what I'm going to walk through here is different kinds of challenges. You know, when people think about EAP, a lot of times they just think about services for employees, but we offer services to leaders and to the whole organization too. And for really small organizations, that's really powerful because you don't tend to have the resources that the larger groups do. Okay, so from the employee perspective, this is the kind of thing that we're seeing in our book of business and through research. None of this is going to be a surprise to you guys, but all of these people are seeking help for stress and burnout, other kinds of mental health issues. 37% of the people feel stressed more than half the time. And I mean, raise your hand if you're not stressed. I mean, not just COVID, but all of the things that are happening. And every time you turn on the news, it's just very difficult right now. And I don't have kids in my home running around and other stressors in my life. 22% feeling depressed more than half the time. That's a scary number. And we're seeing a whole lot more people calling in at risk for suicide. And then 34% feeling burned out more than half the time. And that's the number that really makes people walk off the job and go look for a few extra dollars in another job. That's the one that hurts employers a whole lot. Here's what we've seen just in our book of business in the last couple of years. 24% increase in the use of services. So we're talking now about people who already have a program. They're using it more. So more people in the population are using services. And more people are using life management services. And I'm going to talk to you about what that is, but that's the non-counseling services that we offer. Used to be that people every now and then use those. Those have become a big, big deal now. And with people moving out of the office and into home, a lot more people are looking at their lives and what services do I need? And I think, you know, we're going to have a speaker in a minute talking about some of that stuff. So that's a big deal for employees, even more so than before. And we've also seen people using more sessions than they used to. Used to be that people would stick in only a couple sessions. Now they're staying in 4, 5, 6. So here is what we do to provide services for employees. So I'm just going to kind of run down the different kinds of things we do. So first of all, anything that employees get from FirstSun, once you have an EAP in place, is going to be free to them. We have unlimited telephonic services so that people can call around the clock, holidays, weekends. Anytime they call, they're going to get us on the phone or the counselors that we pay to provide services after hours, weekends, holidays. So anytime you call, you can get help for yourselves, for your employees, for the leaders, for the organization. Our team is on call and our providers are on call, so we've got coverage in all those hours. When people call in for the counseling services, we're going to match people to the counselors that we think are best for them. So if somebody calls in and says, you know, hey, I really want to see a female counselor, or I really want to see a Christian counselor, or I don't want anybody who's younger than me, or whatever they might say, then we can match them to a counselor that fits their needs. We also can tailor things to blend in with insurance. So Ben was just talking about insurance. So if you have Blue Cross insurance, for example, then we can try to pick somebody that's in your insurance network too, so that you can use your EAP sessions and then move on. If you don't have insurance, then we can refer you to somebody who does a sliding scale fee so that you can have lower fees beyond if you want to continue. We also partner with BetterHelp, which is an online service provider, so that we can refer to them, and they have low-cost services after your EAP sessions are used. So we've got, if you want to get counseling, you can come in person, you know, and see somebody in the office, and that would be in an office near you. Or you could go online and see someone by video. We also, through BetterHelp, do chat sessions, and that's where you have sort of a counselor who's chatting at the same time you're chatting, and you chat back and forth. There's no video. And then we have private messaging counseling. through BetterHelp. And that works by the week so that you get a counselor and then you're able to talk to him and her all week long. And each week, each equals one session. And important to know about this benefit is that it's available. Mary Dell talked about this a little bit. It's available not just to your employees, but it's going to be available to their family members and to their household members. You know, we're big proponents of covering the people that are close to you. And a lot of people have non-family living in the house, or they might have unmarried partners in the house. And we want to cover all of those people. A minute ago, I talked about the life management services that people are using a whole lot more now. And that's all these services here. And the idea about this is that we're trying to figure out, because EAP at the base of it is supposed to be about what helps people be productive at work. That's why the employer buys it, because I'm buying something that's not only good-natured and goodwill for my employees, it's not only good-hearted, but it's also a good business decision, because people that have services are going to be more productive. So we provide free legal consultation with a network of attorneys, and you can get that kind of on emergency basis too. So if you get pulled over or something happens on the weekend or on a holiday or something, you can call and get help then. And you can we've got an online will and legal documents section. So this is super helpful for small business. You can get kind of for any state in the country, you can get documents and you can sort of fill them in and it'll guide you through how to do a legal document. If you get a legal document that is attorney prepared, then you do get a discount on that. That's kind of beyond the EAP, but you get a stretchy discount that follows you to that. And then for finances, we've got 3 different sort of levels of service. So if anybody has financial problems, they can call in, and we've got an online service that does coaching, and they can do everything from, you know, tax problems to credit problems to, I don't know, bankruptcy. And then we've got a service that's a little more like the Dave Ramsey program, where we've got a provider that meets with you that helps you sort of change your relationship with money and develop new practices and habits. And then we've got a service that's much more in depth, so that if you're really wanting to figure out, okay, I need to look at the whole picture and figure it all out, that person can work with you on that. And then all of the other services that you see here are of the style where you would give us a call and we would set you up with a specialist that we network with, so that you can talk through whatever's going on and get referrals to resources. There are a lot of ways, of course, to go online and do Google searches, or there's some locator services that you can use. The reason we do it this way is because a lot of times you don't know what you don't know. And so being able to talk to an expert in the field really helps you. You know, if you want to send a child to college, or you're trying to find a resource for a child in school, or you're trying to find a resource for an elder. An example that I have is that at one point my aunt in Georgia needed to leave her home. She just was not being able to take care of herself. And I called them, and it was so helpful because they walked me through. They said, well, you know, what's going on with your aunt? Tell me everything that's going on. And so I was able to describe the whole situation that she was in and why I thought she needed to move. They ended up feeling like I could probably go with an assisted living sort of situation. They ended up figuring out that because her deceased husband was a veteran, that she could get discounts. They ended up helping me figure out how to get Medicare involved, and how to plan for her finances. So it was a whole lot of things that I didn't even know to ask, you know, had I gone sort of to a search. So that's how all these services work. They're all free and they all get you to resources. And then what they did after they pointed me to some vetted places, they sent me some sheets in the mail that helped me, so that when I went there to look at them, I had kind of a list of things to look out for, Like these are problematic things to watch for. These are things that would be good. These are questions you should ask, all that kinds of advice. So all those services are available as well. And if your employees have family members in other states, kind of like what I just mentioned, those services can be useful there. Okay, so now I'm going to leave the employee realm and I'm going to go to the leader realm. You know, if you've got 2 employees, one of them is probably a leader. So groups have leaders and the leaders have special challenges, and we really are looking at those challenges because it's really hard to have a healthy business if you don't have healthy leaders. So leaders have to worry about their own well-being. I mean, they're people too. And they have to worry about the employees that are reporting to them. And those employees have really been struggling. You know, a lot of them have suicide risk. A lot of them are depressed or anxious. A lot of times we have sort of a redesigned way of working, especially through COVID. We made changes to adapt, and then now maybe we're making changes and trying to figure out which ones to keep, which ones to change. All of those changes make it difficult for the leaders. Most of you, I would be surprised if there are any of you that are not dealing with an understaffed situation right now. And then, of course, absentee issues. You know, people have issues with their families and need to be absent, or maybe they're just present and not really working because they're so distracted by things that are challenging them. And then, of course, one thing we're seeing a whole lot of is workers in conflict, and then risk of violence with all of the divisiveness that we're seeing. And, you know, you guys in your kind of work may see that in your workplace with your staff, but you may also see it with your customers and with people that you're trying to help. So that's what's going on. We help with all of that. And we have a service model that really is designed to do that. So that when people call in, we've got our team that answer the phone. That's our intake team. They're taking the calls. We've also got an online setup so that people can go online. They don't have to call us. All those calls come in and forms come into the intake team. And if anything has any kind of clinical risk or workplace risk, then it goes automatically to a special team of risk managers that are going to watch that. And they're ready to help with these kinds of workplace issues. So that if somebody calls in crying or they say anything that makes us think there's a risk of harm, or if you guys have an employee that needs something, you can call that employee in your office and call us, put the employee on the phone and we'll talk to them. If that happens, then they get passed to our risk team and they take care of their needs. They kind of talk them through right there, and then they get them passed on to a clinician for ongoing care. And then one of our services too is that the leaders and managers can refer employees. So even when you have an employee that might be going through a divorce or a situation with a child or a healthcare problem, they may sort of fall down at work and not be performing well. And if that's the case, it's really hard sometimes to think, well, I mean, I don't, you know, poor Joe, he's going through a divorce. I don't want to, you know, write him up. But at the same time, you really need Joe's full attention at the workplace. So one thing you can do is refer Joe to us, and we can talk together about what the challenges are performance-wise, and then we can help Joe. So we take those manager referrals. There's a nice formula for how we do that, and I can walk you through all that. Through the EAP, we've got a lot of specialty programs that we can refer into. So it's not just counselors, it's not just treatment centers that would be under the health plan, but we also can connect to the health plan for their specialty programs, like peer programs for substance use, or specialty treatment programs for depression and anxiety, burnout, that kind of thing. Anytime there are discounts or special programs, our team kind of knows about those and they can refer to them. And then we provide solid case management. So if anybody comes in and there's clinical risk or workplace risk, we're keeping our hands on things. Even when we refer them out to a counselor, we're keeping our hands around things to make sure that people get good care. The main thing that people use us for, the leaders and the manager, is just really to do consultations. They call us just to talk about stuff. They call us to talk about the employees that are not performing well or their teams in conflict. The thing is that our folks are on the risk team that you talk to are clinicians, and they're also business people with some HR skills. So they really do know their way around, here's how to talk to Sally. I know she's your friend. And I know she's struggling, but here's how to talk to her about the performance issues. Here's how to make a referral. Here's how to deal with these two employees that are arguing with one another. So they really help with that stuff. And a lot of the people that work with us say it's like having sort of a coach in your pocket, that you can call any time of day to sort of talk you through something. We help with positive drug screens, and any kind of absentee issues, if you've got policy violations, that kind of thing, or anytime that you feel like an employee is just in trouble. We really want to make sure we're helping with that. And sometimes people will call and say, I don't know if my employee is in trouble. I've seen this and I've seen this, and the other day they said this. I'm just not sure if that's something to worry about. And that's a fine thing to call us about and talk about. And then, of course, threats of violence. And again, I point out not just threats within your team, but threats that may come at you. A lot of nonprofit work in the caring industry is running up against a lot of the divisiveness and judgment. And so there's a lot of threat of violence out there. So we can help with that sort of thing. And then one of the things our customers really like is that we've got a website that's got a bunch of webinars that are free and courses that are free, so that people can go there individually because they just want to have personal growth. I just want to learn how to be more confident, or I want to learn how to deal with stress, or I want to learn how to sleep better. They can go there for those, but also the leaders can refer there to say, I want the whole staff to sort of get a little bit of maybe a skills growth in empathy or something like that. So you can send people there, and then they take the courses and they can get a certificate at the end, and you can see that everybody's taken the course. The other thing is that a lot of groups just are looking for content. Maybe they're trying to put content out to their customers, or trying to put content out to staff members. We've got a lot of content out there that people can just grab and take. And then we've got podcasts, webinars, newsletters, all kinds of stuff. And then we move to organizations. Organizations are going through all of these kinds of problems. The Great Resignation, you guys know this, right? Your people are leaving. And one of the concerns you have is that they're leaving for a company that maybe has benefits. And if you don't, but people are leaving for all kinds of different reasons. Organizations have all the performance and productivity. I don't know about you guys, but if you would have asked me in 2019 what people were doing and what people are doing now, it's a whole different picture. I cannot even imagine asking people to do what they used to do. They just won't. And I think even for the people who want to, they just can't, because too many other things are going on. There's a culture shift that's going on, and we really have to pay attention to that. People have to collaborate differently. They have to connect differently especially if they're working remotely or hybrid. Customer service is a huge issue. So many people, as you know, are just very impatient and abrupt, and they want everything right now. And if it's poor service, they get so angry. And then just strategic direction. A lot of times groups will call us and just talk through, we're really trying to get some support for our leaders as they guide us. We're having to hold so many things because staff can't do it and things are getting put behind, and now they're trying to decide how much to push people. We help with all that stuff. And these are some things that people call to consult through that aren't just organizational issues, but sort of everyday issues, FMLA stuff and ADA stuff. I'm not sure if this is an ADA thing or not. You can call about that sort of thing. And again, tiny, small companies don't tend to have HR. You have one person that's wearing the HR hat and the finance hat and, and the planning hat and all that. So we can help with some of these specifics. All right. And then a lot of people know EAP for critical incident services. And we have actually a different name for that. We call it disruptive event management, because we sort of make the circle bigger than just somebody, dying or a fire or an accident. Really, if you think about business, everyday business gets disrupted all the time. Maybe you have an employee who you've known for a long time has been sick and they do finally sort of pass away. Everybody knew it was coming. It's still disruptive. You hire a new leader, maybe it's disruptive. You know, you make a change in a policy, it's disruptive. So many things can happen, and we can consult about that. We can consult before you make the change, or if you see something coming, if something surprises you, we can consult with you about, okay, here's some things to think about the best way to take care of your folks. We can come on site and help out. Through COVID, a lot of groups had us do outreach calls, you know, like we made a change and everybody's good with it except Susie. Can you call Susie and kind of just see if she's okay? So we can do a lot of different things related to that. We can give educational handouts so people can see sort of how this sort of thing affects them. I talk super fast and I said a bunch of stuff, and I know that there may be questions. I want to say one more thing about us. And I already said, you know, that we're 20 people. And then I went through so many services, and you guys are probably thinking, well, how do 20 people do all those services? Well, the thing is, if you look at our logo, that's the way we work. We're always in partnership with a bunch of people. It's a circle and it's a bunch of partners. So that if you call us for training on DE&I issues, we don't do that. But we have a partner who does, and we can connect you to that training partner, and being a FirstSun customer gives you a discount to that service. So we know how to get to a lot of resources. All right, so that's all I'm going to say, and then I'm going to invite questions, and I want to make sure to leave time for the other speaker too.
So I want to jump in and just reiterate, when I was an executive director, we had FirstSun as our EAP, and it was such a tremendous resource to have as a small nonprofit, to be able to have that assistance with human resources, to be able as a manager to say, hey, employee, I think you're really great, but I think it's time for you to connect with our EAP, and to know that our employees would be able to get this confidential support and get referral to really high quality providers in our community. And so I have personally seen the benefit of working with FirstSun and making sure that your employees can get the mental health care they need, but also getting that help with navigating financial counseling, making sure that you're using your budget the best way possible personally. And then, of course, as a manager or executive director, having that support and navigating critical incidences, or just figuring out the best ways that you can support your people. And so, Maria, I'm so glad that you're here. Are there any questions that anybody would like to ask or get any guidance on? I know it can take a minute to get off mute, so I'll give everybody just a second or two if you want to drop something in the chat. We covered a lot of ground real fast. And definitely hold on to your seats and keep paying attention, because we've got a fantastic way for you to bring FirstSun to your organization that we can't wait to unveil very soon. It's going to be awesome. And again, I'm just a true believer in this, because I have seen it work, and it's just amazing how much bang for your buck you can get, and really expanding the support for you as a leader in a very lonely role. But also getting that critical help for your employees to help you retain and engage your workforce better. So I don't hear anybody jumping in. Maria, that was awesome. Thank you so much. So I'm going to let Tom, do you have a question? I think I saw you come off mute.
Yeah, I have a quick question. What is the cost for the employer?
That's something that we're working out. We made a first foray in to look at how we could do this for the group. So we don't have an answer for that yet, unfortunately. I'm sorry.
Okay.
But I will say that if you came to us today and said, you know, I have fewer than 50 employees, that the price that we're promoting is so much lower than what you could get from us direct. Because what the model is that we're pretending like this is one giant company. So we're having like sort of one startup in maintenance, you know, we have one admin group to do. And we're pulling stuff out like the reports that you guys probably wouldn't want to get anyway if you've got so few people. So we just kind of pulled everything out that we could to try to really strip it down. The whole point is to make it affordable.
Thank you.
We think you will be very, very pleased with the rate that we're kind of swimming around. And so, Maria, is it okay if we said it will be probably less than $5 per person per month?
Yeah.
So I think that you will be very pleased when you see what we end up with.
Okay, I'll sign up.
Yeah, I mean, we tried to make this sort of a no-brainer. You know, I mean, it's kind of like, yeah, let's just, if we do it this way, it actually works for everybody. It's so good. And, you know, we did something like this for the South Carolina farmers. I don't know if you guys have seen it in the news or anything, but we put together a product for, it's called South Carolina Agri Wellness. And it covers all South Carolina farmers and their family members. And it's the same kind of model. And by the way, if any of you guys are in the farming industry, and that can be anything touching farming, selling implements or insurance, or doesn't have to be, you know, having, you know, pigs or corn, but anything related to agriculture, you can call us. And it's just like sort of being in the military, you know, you get sessions free. So it's similar to that. So we're excited about getting underserved populations, basically, that don't typically get to afford this sort of thing.
It's really awesome. I'm getting a lot of questions in the chat and DMs about getting this information. So we will be sending out the recording and the slides tomorrow, and then be on the lookout next week for more information. Those of you who are here live will be the first to hear about the great opportunity to join us. And to bring this benefit to your employees. So with that, I want to turn it over to Brandy, who I've had the delight of working with for years. Brandy is with WREN, the Women's Rights and Empowerment Network, and they've got a tremendous volume of research about the impact of parental leave. And I think that's something we've all struggled with navigating as executive directors, which is you want to support your employees when they're adding to their family, and you want to be there for them, but also the work still has to get done. And so it definitely can create a tension as you're trying to figure out how to balance those competing needs. And so I'm excited for Brandy to be able to share some of this research and then some ideas about ways that you can navigate supporting families in the workplace. So Brandy, I will let you take it away.
Okay, great. Thank you, Mary Dale. Let me set up my share screen now. I also have a few slides. And can you all see can somebody give me a thumbs up? Mary Dale says yes. Okay. So again, my name is Brandy Parrish Ellison. I use she, her pronouns. I'm with the Women's Rights and Empowerment Network, and also known as WREN. For those of you who have never heard of WREN, we're a statewide nonprofit organization that's mission is to build a movement to advance the health, economic well-being, and rights of women, girls, and gender expansive people and their families in this state. We do this work through legislative advocacy, education, research and education on topics and issues that impact women and girls and gender expansive people. We do a lot of coalition building, and we have within our network around 40,000 individuals who are constituents that we engage in advocacy efforts as we're moving through local, state, and federal policy debates. So we do a lot to connect people with their policymaker and remove barriers to having a voice just in that process. We cover many topics. We take a very holistic approach. We cover a lot under when it comes to economic well-being, a lot when it comes to healthcare and education, civic engagement, and just about anything else that, and all things, right, that intersect with gender justice. One of the big projects that we have and ways that we are impacting the state is through our Power Up, Igniting a Resilient, Gender Equitable Workforce. And what we've been working on over the years is just a collection of research, reports, tools, and creative spaces that we bring people together and address workplace inequities. And in this project, women as an untapped resource to the workforce shortage. And going back to what we were talking about earlier, ensuring that we can change workplace culture and policies to be more equitable so that you are more competitive in this great workforce and able to attract, hire, and retain the employees and the skills that you need. Some examples of that work under Power Up includes a recent study that we did on women in the workforce. It was analysis on the labor force participation, especially before and after COVID. COVID put a spotlight on a lot of the issues that your employees, we as employees have faced for many years, but were just exacerbated due to COVID. And it really looks at what the workforce looks like, what recovery looks like, what industries were the hardest hit. And as you can imagine, those were a lot where they were majority female employees. And then what it takes to build back your workforce and again, attract and retain diverse employees. We also have a playbook for advancing gender justice and an action agenda. Both of those items really act as tools to help businesses of all sizes think about and take those first kind of tangible steps in becoming a more equitable workplace. A lot of people have an outward commitment, but when it comes to making it happen internally within their organizations, people get stuck, right? Businesses get stuck. So it's really a way to kind of start your thinking, to think creatively and kind of highlight the ways that businesses of all sizes are tackling benefits and workplace culture and policies to be more equitable. So today we're going to focus on paid parental leave. Families and businesses in our state, our economy, all depend on women. Women are the primary or co-breadwinner for 2/3 of South Carolina families. That's a big number, 2/3. That means that families depend on women to help meet their financial needs. And when women are not paid equally or do not have the benefits to continue and sustain their job while also caring for their family, they're often put in a position to have to pick between the two, and then the family suffers. So women and working families really are a key critical part of our workforce shortage. And in a recent poll that we did around the state, we found that 90% of South Carolina voters support paid leave. That shouldn't be a surprise to anyone. We have all needed some sort of paid leave for a life occurrence, whether it be to care for a loved one, children, to help a parent, to help a spouse. So paid leave overall is a very big topic of conversation right now. And parental leave in particular is one that is really critical. So what are some of the public health benefits of having paid parental leave? We know that there is a reduction in cesarean deliveries. We have higher infant mortality, longer periods of breastfeeding, prolonged gestation, less mental health issues for the parents, more engagement of parents, and just overall increased bonding and well-being between the parent and the child. It's also good for business. We employees are looking for places that have good benefits and take their work-life balance into consideration. With offering paid leave, you can reduce your turnover cost. More people are coming back to work after they take paid parental leave. They are coming back much happier, much able to focus on their jobs. You don't have to worry as much of actually going through the recruiting and the training process. It's just overall much more sustainable for your individual workforce. Productivity is up. job performance is up, and overall morale. When, a lot of, as Maria pointed out earlier, employees are looking for employers and expecting things out of employers now that they never did before, right? And so to be competitive and to draw in employees and to really have, invest in your workforce, you have to take some of these things into consideration and really think creatively about how to make them work. So how do you make it meaningful? Like, yes, I want to offer paid leave. I know that paid parental leave. I know that that this is something that my staff wants, that will really propel us as a competitive employer. So some things to think about is the gold standard is at least 12 weeks of paid parental leave. That's 3 months of bonding time between a mother and a child. And the fact that it also gives the mother, the birthing parent, an opportunity to heal and recover from childbirth. Many daycares do not take kids or babies until they're 6 to 10 weeks old or older. So they have to be able to have vaccinations before they can go into a child care program. So really giving that time for family is really critical. Another thing is to really think about how both parents, it's not just about women, but ensuring that both parents have male or female or other gender expansive people on your staff have an opportunity to take paid leave whenever paid parental leave. And there's different ways to approach that, which we'll talk about some of those examples in a few minutes. Also that it includes adoption, and some even include for foster parents offering some sort of paid parental leave at the start of an adoption or fostering of a child. The other thing is offering paid parental leave that is not taking away from an employee's earned vacation and sick leave is so important. A lot of times employers require that employees use down their vacation time, use down their sick leave in order to, and then have whatever's left of that time be able to take FMLA or paid parental leave. If you are a parent or have someone close to you in your life at any point that had a new baby, the first year of that child's life, you spend a lot of time at the doctor's office. There are regular checkups, there are ear infections and colds and all the things that require parents to take some of their time off to take their child to the doctor. So when you ask people to deplete their sick leave, you're basically leaving them with no time to be able to take that child to the doctor. Also, that earned vacation is really critical, I think, overall for morale and mental health. And then providing parental leave, if you can, at 100% of the employee's wages. There are other ways to approach that. That, of course, is the gold standard. And then I will share with you, so the Women's Rights and Empowerment Network, WREN, I will share our paid parental leave policy with you as an example. We're only a staff of currently 9 full-time employees. Our max has been around 13 full-time employees. So we're a small operation with a lot of work to do. Now that the legislature is basically in session all year, you can imagine that we stay busy. So one of the things, or what our program looks like, full-time employees who've been employed continuously for 12 months are eligible. And they're eligible for up to 12 weeks following the birth or adoption of a child. And it's currently at 100% of their salary and health benefits that they're enrolled in. It does not deduct from their vacation or their sick leave, but we do require that the employee takes the block of 12 weeks at one time. Some employers, especially if they're larger, are able to spread that time out, but because we are a smaller operation, getting that information, knowing in advance that someone's going to be out, and also knowing the amount of time is really critical for us to be able to make sure that we have coverage of the work. And we also have in our policy that we will consider an agreement for use of some of that leave time before or after birth, depending on if there's any, major health issues with the mom or the new child. So there's flexibility in there in how you can use it or when it starts, and then, further opportunity, an open door to have more discussion if there's other issues that come up. I will say that knowing that when people know that they have access to this leave, they know their coworkers are going to be covering some of the work. They know that they're going to be out. The trust and ability to come forward, let an employer know, go ahead and be proactive in setting up, this is what work can look like while I'm out. This is what realistic communication looks like while I'm out. This is how I want to transition back into the position while I'm out. A lot of this just opens up a door for a lot of very, transparent conversations around employee needs around parental leave. Other ways that you can support employees that are working parents is to allow for a flexible work schedule. Another thing that's really creative that came out was during our conversations, our forum and discussions with different businesses and different industries was, if somebody is out on parental leave, they're out for 12 weeks, and there's a performance evaluation that is planned right after they get back, that they have a policy in place that says we will hold for six months and then do the evaluation, or base the evaluation on the time period that the person is actually in the office and working, so it's not a penalty to be seen as, in your permanent file that you have an evaluation right as you're coming back and you've been out. Also providing private clean accommodations for parents to express breast milk, and then again the ability to earn paid sick leave are really, really great ways that you can support families. Some other examples would be giving employees a certain number of hours per month that they can use to volunteer or use for time to meet with teachers or to do something that's related to the well-being of their family that doesn't take away from their vacation or sick time. A lot of times when you offer that, you again have that people are more proactive in communicating, taking less unexpected time off or last minute time off, because they really see how they're being supported and given the opportunity to communicate proactively. So WREN is really invested in this, and I'm super excited to say that we have led many policies, passage of many policies at the state level that support working parents. Paid family leave for state employees was actually signed by the governor today, yay. So starting October 1st, state employees will have access to paid family leave. They will not have to use their earned PTO. And again, we did some negotiating and really interesting breakdown of what that time looks like, which will be another example I'll share with you in just a moment. We also led the passage of the Lactation Support Act in 2020, ensuring that an employee can express breast milk up to 1 year after birth. The employer must provide a clean, safe, private space to do that so that people are not in the bathroom expressing breast milk. and that actual break time is given to the employee. We also passed the anti-shackling of pregnant inmates, which is really great because so many, I don't know if anybody's ever been through labor and delivery, but could you imagine being shackled to a bed while you're going through that process? I wouldn't consider you a flight risk if you're in the middle of labor and delivery. I don't know, maybe that's just based on my personal experience, but this is a really great way to really focus and make sure the health and well-being of these pregnant inmates is prioritized. Expansion of 12-month supply of contraception, ability to have that coverage, get that prescription for 12 months at a time. And then we also led the passage of the Pregnancy Accommodations Act, which was, it applies to 15 or employers that have 15 or more employees, follows the ADA standard of a reasonable accommodation. Essentially, if someone is working at a register and on their feet all day, they can have access to a stool, a water bottle at their station, extra bathroom breaks if those are limited, and really just ensuring that, mothers can stay on the job and have the ability to continue to earn while they're pregnant for their families that they're helping provide for, and that they're not having to take leave unnecessarily while they're pregnant, that they can save that and use that, whether it be paid or unpaid, once they give birth. We also have worked on the floodgates have opened, attacks on reproductive freedom and access to reproductive health care. So it's another thing that we do a lot of. So again, exciting day for us, signed by the governor. Employees will have access beginning October 1st. And here's kind of an example of how they broke it down. I thought it was one of the better examples because it really looks at for the birth of a child, for adoption of a child, and when fostering. And while we really advocated for those 12 weeks, they agreed to 6 weeks of leave for state employees who give birth, 2 weeks for leave for the employee that is a caregiver that did not give birth, and then 6 weeks for the primary caregiver for adoption, 2 weeks for the non-primary caregiver, and then 2 weeks for foster care. There was, along with using the 6 week, the employee can add to that up to make it a total of 12 weeks by using some of their paid time off. So it is a step forward. It's one of the better state employee plans that are offered around the country. We're very, very proud of it. We had so many people come forward that were having to go back to work, a week after they'd given birth or 2 weeks after they had given birth. And not only just, really talk about the impact that it had on them in their healing process, but also to leave their infant after such a short amount of time. So that's really exciting, and we're very, very proud of that victory. So we do a lot of great things in the state and offer a lot of resources and tools, ways to advocate, but also ways to just, be a leader within your organization and create a more equitable workplace. Everybody has a role they can play in doing that. So if you want to learn more, you can always visit scwren.org. We are on all the media platforms. And our Power Up is listed on our website under our main projects page. So I'll stop now to see if there's any questions. I think I talked too long, Mary Dell.
Talk about some of the other ways that people navigate the family leave thing. So like I'm thinking short-term disability.
Yes.
And I guess I'll start with that.
Yeah, so some employers offer, and I'm thinking right now specifically about A lot of our school districts, an employee can buy into a short-term disability plan where they pay monthly toward short-term disability, and then they have a certain percentage, if not all, of their wages while they're taking their leave. And those employee plans are offered by a number of benefits providers. Most benefits providers will give you some options as an employer for what that could look like. So I would say some of it comes out of the employer's pocket, some of it comes out of the employee's pocket. But if in the current time, access to paid parental leave is not attainable for your organization, it definitely is a really great place to start, because recognizing the need of your employees is really important, and investing in the future of our future workforce is very important.
And I know that one of the things that we worked on when I was an executive director was we had an infant at work policy. So you could bring your baby to work with you up to 6 months. And a lot of times, babies before 6 months aren't doing much of anything besides sleeping. And so that kind of helped us navigate not offering the gold standard, but trying to support the women in our workforce while they were trying to navigate being a mom, but also wanting to work. Are you seeing that become more common, or how are people navigating things like that?
Yeah, it's interesting. We work in the former BB&T building. It's a large building on Main Street in downtown Columbia, 24 floors. It's now the Truist building, only to say that because there are many employers in there. And when we passed the Pregnancy Act, it was interesting the number of insurance providers, like companies and other corporates, whether they be large or small, private sector businesses, saying we just started our you can bring your baby to work. And I think you're right. Whenever the infant is smaller, right, 6 months to a year, a lot of that is you can still do a lot of work while you're there, right, while you have that child with you. So some businesses definitely have that policy and are being very creative in the approach. And I love to see how excited some of these private sector businesses are about it. The other thing is, being flexible as far as can a parent work from home during their first weeks or months after birth. Of course, having time completely off is important. But we all know now because of COVID, and I look at all of you here on a Zoom call, and we realize how much we can do on the computer and on Zoom. We have all stared at our faces long enough on the videos, right? We're all comfortable just watching ourselves work. So now a lot of hourly employees cannot always do that, but especially, with remote work and the nonprofit sector giving opportunities to be just creative and flexible about how we connect and allow people to work and be flexible in their working time and space is a really good opportunity to have.
Well, it's 3:05. I could talk about this all day. Does anybody else have any questions they'd like to jump in or get some feedback on? Feel free to jump in at any point while we're wrapping up. I want to thank everybody for being here. Gosh, this is a lot of information. There's so much that you can do to make sure you're attracting and retaining a really impactful group of talented people. I want to thank all of you for taking the time to be here with us to discuss, and really, we've got to all start thinking outside the box about ways that we can stretch our budgets. And, you don't have to offer, if you're unable to offer health benefits, you can probably afford to offer an EAP. You may be able to do more with paid leave. And so really trying to navigate building the best benefits package that you can. And we are so grateful to all of you who are here. Thank you again for being with us